I'm Secretary of the Department of Children and Families in Florida and have been Secretary for the last 2 years. We administer a number of human service programs, but notably for today's purposes, child welfare and child protection. The waiver has, as Congressman Linder has already indicated, has shown dramatic impacts in Florida. We've safely reduced the number of children in out-of-home care by 36%. From 29,000 to about 18,000 in the period of the last 4 years. When children are removed, the time necessary for reunification has been shortened from about 10 months to 8 months. Because we're able to provide services to the family, not just the child, under the waiver, and I think that's important. And with that shortened length of time towards reunification, re-abuse is down after reunification. But we've also made a major commitment to permanency, and that's a commitment that we've made. We put about $1 million into a major public education campaign to promote adoptions. So in the period of the last 4 years, we've had over 12,000 adoptions. In addition to that, 14,000 guardianships. So as we've tried to deal with services in the home, if we cannot reunify, we attempt to move to permanency as quickly as possible. I think that's critical. But ultimately, I think it's not about the numbers. It's about a young girl by the name of Kimberly who was on psychotropic medications and was told that she would live the rest of her life in a psychiatric institution, but is now graduated from undergraduate school. It's about a woman by the name of Ruth, who I met, whose children were removed from her, and at the reunification ceremony, I remember her saying, "I never thought there'd be a ceremony honoring me." And she admitted her substance abuse issues. It's about a young man by the name of Mike Dunleavy, who was in foster care and is now in law school at St. Thomas University. And I think it's important for us to look at the individual cases. Florida was granted its waiver in March of '06, and when I came to the department in January of '07, implementation of the waiver was in its very early stages. Under Governor Christ and then Secretary Butterworth, and with the support of community-based organizations, implementation became one of our highest priorities. In the past 2 years that I've served as Secretary, it's continued to be a central part of our child welfare program. Early in the administration, I sat down with 15 young people who had aged out of foster care. I thought it was going to be a kind of a brief ceremonial visit. 2.5 hours later, I think I learned more about foster care than I've learned from all the professionals. And I'm not taking anything away from professionals, but we designed a whole child welfare system in this country, and we never talked to kids. And who has more at stake? And what those young people convinced me was that if the child can remain at home safely, that is the best alternative. Child after child after child told me I would have rather stayed at home and dealt with the issues in that home than gone into a foster care system where I was moved from home to home and school to school. It's because of young people like that and the stories that they've told me that is the reason that I'm committed to attempting to change the way we deal with child welfare in Florida. I know it because they've told me that they would have preferred living at home. I know it because the reforms I think that we have undertaken in Florida and that you're discussing here are in the best interest of children. We've established a goal to reduce the number of children in out-of-home care by 50% by 2012, not as an arbitrary number, but because we believe it's the best way to provide safety and permanency for children. No child should grow up in foster care. No child should age out of foster care. If they do, I think that we have failed. We have not yet achieved that goal in Florida, but we are making progress. The New York Times referred to it as Florida's radical transformation in child welfare. And I think it is principally because of the FOIA waiver, but not that alone. It's because of the leadership that has developed both in our private community-based organizations and at the state level, including in the Florida legislature. Our community-based partners are doing innovations such as intensive in-home services to give families the support they need to be successful. Mental health and substance abuse and domestic violence, which drives so much of child welfare, have to be an integrated part of that. Florida's system is nowhere as close to where I think it should be. but we've come a long way so far. I would encourage you not just to consider extending the options for waivers, but I think the demonstration of the success in Florida has really said that we are on the cusp of what should be comprehensive finance reform in the child welfare system. Thank you, Mr. Chairman.